My name is Dr. Josh Greenberg. I'm a vascular and endovascular surgeon here at Mercy Health St. Mary's. I think to give an overview of fenestrated aortic stent grafting just requires a little brief overview of aortic stent grafting to begin with, since it's a complex version of it. Aortic stent grafting is a procedure that began in the late 90s as an alternative to open aortic surgery for aortic aneurysms. In the past, when patients had aortic aneurysms, which is a dilation of the aorta, which is the largest blood vessel in the body, and in this case in the belly, open surgery was called for, and it required a very large incision down the middle, and the aorta was basically replaced with an artificial tube. In the late 90s, it was basically determined that an alternative to this would be to place a tube from the femoral artery in the groin into the aorta, basically replacing the old bad pipe with a new pipe, so that flow would be redirected down that tube into the aorta, from the aorta, without the need for open surgery. That's been an extremely successful procedure, and essentially now the majority of aortic aneurysms are repaired using this minimally invasive technique whereby this tube is delivered from the groin. The procedure, which began in the late 90s, initially began in the operating room and is still often done in the operating room, but as we've moved to hybrid operating rooms, which are operating rooms fitted with radiology machinery as well as the ability to do surgery, that is preferentially where it's performed, particularly when dealing with more complex aneurysms, which is the newest variation of endovascular aortic aneurysm repair, such as fenestrated abdominal aortic aneurysm repair. Fenestrated abdominal aortic aneurysm repair is a newer procedure which became FDA approved in 2012, and what that involves is the ability to treat aneurysms that are more proximal or closer to the heart, so that instead of just having a tube replacing the aneurysm, it's a tube that has holes in it to accommodate major branches, such as branches to the kidney as well as to the superior mesenteric artery, which of course is a vital artery to the small intestines. So this was a very important evolution in aortic stent grafting that we now have available to us.